Myself V.Rajeswari. I am from 3rd Biochemistry. My seminar topic is ABO blood group system in human body. In human body, two types of blood group systems are there: ABO blood group system and RH blood group system. In introduction of blood group system, a group also called as a blood type. Classification of blood is based on the presence or absence of inherited antigenic substances on the surface of red blood cells. These antigens may be proteins. These antigens may be proteins, carbohydrates, glycoproteins, glycolides, depending on the blood group system. In the ABO blood group system is the most important blood type system in human blood transfusion. ABO blood types are also present in some other animals. For example, rodents and apes such as chimpanzees, bonobos, and gorillas. Determination of ABO blood groups depends upon the immunological reactions between antigen and antibody. Antigens are also called agglutinogenous because of their capacity to cause agglutination of RBC. In 1901, discovered the ABO blood group system. Carl Landsteiner discovered the ABO blood group system in 1901. Adreno Sturley and Alfred von De Castillo, who were working under Landsteiner, discovered type AB a year later in 1902. Landsteiner was awarded the 1930 Nobel Prize in Physiology or Medicine for this work. Landsteiner rule: if an antigen is present on the patient's red blood cells, the corresponding antibody will not be present in patient's plasma under normal conditions. ABO basics. ABO blood group system basics. Based on the presence or absence of antigen A and B antigen, blood is divided into 4 groups: A, B, and AB and O group. Blood having antigen A belongs to A group. This blood has beta antibody in serum. Blood with antigen B and alpha antibody belongs to B group. If both the antigens present blood group is called AB group, and serum of this group does not contain any antibody. If both antigens are absent, the blood group is called O group, and both alpha and beta antibodies are present in the serum. ABO blood group system. Antigen present on ABO blood group system in body. Principle of blood grouping. Blood grouping is done on the basis of agglutination. Agglutination means the collection of separate particles like RBCs, red blood cells, into clumps or masses. Agglutination occurs if an antigen is mixed with its corresponding antibody, which is called isoagglutinin. That is, occurs when A antigen is mixed with anti-A, or when B antigen is mixed with anti-B. Importance of ABO blood groups in blood transfusion. During blood transfusion, only compatible blood must be used. The one who gives blood is called the donor, and the one who receives the blood is called recipient. When transfusing, the blood antigen of the donor and the antibody of the recipient are considered. The antibody of the donor and antigen of the recipient are ignored mostly. Thus, RBCs, red blood cells of O group, has no antigen, and so agglutination does not occur with any other groups of blood. So O group can give O group blood can be given to any blood group persons. Persons and the people with his blood group are called universal donor. Transfusion reaction due to ABO compatibility. Transfusion reactions are the adverse reactions in the body which occurs due to transfusion error that involves transfusion incompatible blood. The reactions may be mildly causing only fever and hives, or may be severe, leading to renal failure, shock, and health. RH blood group system. Second one is RH blood group system. The RH blood group system is one of 35 current human blood group system. It is the most important blood group system after ABO. RH blood group system consists of 50 defined blood groups antigens. Among them, there are 6 common types of RH antigens, each of which is called RH factor. These types are designated C, D, and E. The type of D antigen is widely prevalent in the population and considerably more antigenic population and considerably more antigenic than the other RH antigens. Anyone who has this type of antigen is said to be RH positive, whereas a person who does not have type D antigen is said to be RH negative. Symptoms and signs in the newborn. Anemia that creates the newborn pallor. Jaundice or yellow discoloration of the newborn skin. Scala or mucous membrane. Blood transfusion. Blood transfusion is generally the process of receiving blood products into one's circulatory inversely. Transfusion are used for various medical conditions to replace lost components of the blood. Early transfusion is used to whole blood, but modern medical practice commonly uses only components of the blood, such as red blood cells, white blood cells, and plasma clotting factors and platelets. Processing. Thank you, ma'am.